Session 4.2.2. Research Objective Setting. Learning Objectives. 1. To formulate research objective that is SMART. Specific. Measurable. Attainable. Realistic. Time-bound. 2. Formulate specific objectives that contribute to the attainment of the general objective. Research process. Setting the research objectives. Ask AI. Alt. Characteristics of research. Sanchez, F., Baltazar, J. 1989. 1. Demands a clear statement of the problem. 2. Requires clear objectives. 3. Requires a plan. 4. Builds on existing data/work of others. 5. Empirically verifiable. 6. Generalizable *, quantitative research. Research objective. Defines the expectations of the research. Goal of the study. Knowledge that will be \generated. Declarative statement. Uses of research objective. 1. Gives indication of the relevant variables to be considered. 2. Guides the researcher in the choice of the research design. 3. Tells the researcher what data to collect. 4. Basis for the data analysis plan. Setting the research objective. Transform research question from interrogative to declarative sentence starting with the phrase to determine, to examine, to describe. Research question rightward arrow research objective. Research objective is. Goal of the research. Specifies the to be generated. Examples. To determine the prevalence of malnutrition among 0 to 5Y.0 children in Varanasi X. To determine the association between X and Y among adults. Research objective is not. Not project objective. Not an activity objective. Examples. To decrease the prevalence of malnutrition by 20% in 2 years, project objective. To measure the height and weight of malnourished children, activity objective. To conduct a randomized clinical trial, activity objective. Qualities of research objective. SMART. Specific. Measurable. Attainable. Realistic. Time-bound, if applicable. Example, to determine the prevalence of use of household herbal preparation for cough and colds among adult residents of Region 2. Specific. Specifies the variable and study unit. Study variable equals use of herbal medicine. Study unit equals adult resident. Setting/study area equals Region 2. Measurable. Empirically verifiable measurement of the variable. Equals use of verb. Where appropriate, statistical/AP measure is indicated. E.g. prevalence, incidence, proportion, average, etc. can add to. The variable being measurable equals prevalence. Attainable. Research problem can be answered by the data that will be collected. Equals prevalence of use can be obtained by getting the proportion of users, #users/#users plus #non-users. Realistic. A practical method of collecting data is available. Equals query method. Time-bound, if applicable. Time element specified, if applicable, usually in longitudinal type of study. Equals not applicable in prevalence study. Types of objectives. General, overall goal. Derived from the statement of the main research question. Specific, specific outcome/s expected of the study. Derived from the statement of the sub-questions, components of the main question. Relevant to the general objective. Contribute to the attainment of the general objective. Secondary objective. Examples. Case 1. Research problem. Is herbal medicine widely used in the community? Problem components, specific objectives. Type of herbal medicine. Preparations. Age. Leanness. From, research questions. What is the prevalence of use of any herbal form for common illness among residents in Region 2? 2. Objectives. General objective, main Q. To determine the prevalence of use of any herbal form for common illness among adult residents of. Specific objectives, sub-questions. From, sub-questions. What herbal preparation is commonly used by residents of? What is the age distribution of residents who use herbal medicine in? What type of illnesses are herbal medicines commonly used by residents of? 2. Specific objectives. To determine the type of herbal preparation commonly used among resident. To describe the age distribution of residents who use herbal medicines in. To determine the types of illness for which herbal medicines are used by residents of. Case 2. General. To determine the knowledge, attitude, and practices of OFWs regarding HIV. Specific. 1. To determine the proportion of OFWs who have correct knowledge regarding the cause, transmission, and prevention of HIV. 2. To determine the proportion of OFWs who have positive attitude towards A. 3. To determine the proportion of OFWs who practice the following preventive measures, A. 4. To compare the CAP among OFWs across the stages of the migration process. Case 3. General. To determine if there is an association between cigarette smoking and lung cancer. Specific. To determine the proportion of smokers who have lung cancer. To determine the proportion of non-smokers who have lung cancer. 3. To compare the proportion of lung cancer between smokers and non-smokers. Case 4. General. To determine if drinking 1 shot of alcohol per day for 2 years will reduce risk of fatal and non-fatal heart attacks by 40% compared to non-drinkers. Specific objectives. To determine the proportion of fatal and non-fatal heart attacks among 1-shot alcohol drinker. To determine the proportion of fatal and non-fatal heart attacks among non-alcohol drinkers. To compare the proportion of heart attacks between those who drink 1 shot of alcohol and those who do not. Case 5. General objective. To determine the effectiveness of ATIS leaf extract applied on the scalp in the treatment of severe pediculosis among school children. Specific objectives. To compare the cure rate between children given ATIS leaf extract and those not given the extract. To compare rate of cure, among children given the following doses. A. 3x a day for 5 days. B. 3x a day for 3 days. C. 1x a day for 5 days. D. 1x a day for 3 days. To determine the proportion of children who manifest with adverse conditions. Summary. Research question. Clear and specific. Downward arrow. Setting of research objectives. SMART.